As every person has a system within them that allows them to deal with this. Would you agree with that? Hmm? Everybody have within them this, right? As soon as anything disturbs your homeostasis, your body goes into this. True or not? It's a natural recuperative or to recuperate system. Alright? That's why antibodies are created. Start snorting because something needs to be flushed out. Start sneezing. You're coughing. The fact that there's a fever. The body is responding to something that is disturbing it. Would you agree? One doctor calls this, let's spell it right, the homeostatic response. Our bodies strive always to be in balance, correct? So when there's a disturbance, or when there's something that causes us to fall ill or to feel ill, it leads to changes within ourselves, changes within the body. And those changes causes the immune system to become activated. And it begins to fight back so that there can be better resistance. And sometimes there's a compensated skill that develops. For example, if a person suffers blindness, their ears become a lot more acute. They can hear extremely well, much better than when they were not blind. Would you agree with that? So there's some compensating skills that kick in. They begin to compensate. Left hand, you had a stroke, and you were right-handed, and your thing on this side, people have to use the other hand, right? So some compensating skills may come in. So people begin to compensate. But there's also something that is important from the patient side. And that's this. And this is what you want. You want that there is some level of adaptation by that patient to their condition. And it's important that as caregivers, nurses, that you help to stimulate and motivate persons in that direction. But it's important to do it in a positive way as opposed to negative. Where you expect to lift you up, use your bigger head raise, try and move. Now that's a cultural response. A professional response is, if you work with me, let me help you, you can do better. You can do it. You can do it. you are stimulating the creative response in them so that they can adapt to the condition they're in rather than sitting here Elmer. Right? Because that's where you start to hear things like, I can't get nobody help me at all. I hear that, you know, nobody will come to me, nobody will do for me, oh God is for me. Everybody, nobody, somebody. When you hear those extremes, that person is not doing this. And it can frustrate you, get you angry, because they're colored, they're acting like big babies in here. Big grown woman, big grown man. It can frustrate you, especially if there are others that you need to take care of. All right? There's a third aspect of illness that we need to pay attention to here. We are met with the confrontation of the person who is presenting to you with an illness. So let's come now directly. And you will notice that I keep putting person here all the time because I want us not to just think of people as the professional designation, but to keep the humanity in view. Are you with me? It is very easy to dehumanize. It is very easy to look at someone in a different light, especially when we have to cope because of what's coming at you constantly. It is easy to displace it in your mind, and it's easy to put it in a way that the defense will come up and you don't have to do A, B, C, D, or G.